One of the common questions we get, it might look a bit funny. Young people come to us, sir, I have my marriage, my teeth are discolored because I have a habit of chewing pan or I have the habit of chewing tobacco. Two questions they ask. One is immediate fix before going to the marriage. What can be done so that my would be will not feel disgusted? And second question they ask is, I don't want to quit pan or tobacco. Still, I want my teeth to be looking good. So, in two scenarios, what's your take on it?
So, as you told, quit pan or not.
Yeah.
It's there specifically mentioned onto the box. It's harmful substance,
Right.
not to consume. So, keeping that aside, better not use it, but you cannot eradicate a patient
Right.
who comes to you with the same.
Right.
Just do some amount of counseling so that at least initially he'll reduce the quantity of intake, and in the same way slowly he might taper, or he should taper the consumption particle or the consumption product whatever he is consuming, let it be pan, gutka, tobacco or cigarette, because that will not only affect his oral health but also will definitely affect his entire body system.
Right.
So that is even a problematic thing which leads to oral cancers. Nowadays there is too much amount of awareness and ads where you go to a movie theater and they portray the
Yeah,
ad
our
about,
Mukesh is a very famous guy in that.
yeah, so they portray the ad in front of you not to consume the product. But in the same way, when a patient comes to you and want an instant betterment of that condition, yes, there are few conditions which can be treated. If he is not having any deliberate conditions like mal-aligned teeth or much amount of decay in the teeth, yes, we can do that by two protocols. One is scaling. Scaling is nothing but debridement of the remnants which are there on the tooth. To be more simplified, just removing whatever is being attached to the tooth. So in that there will be different particles. One is plaque, which is a thin layer onto the tooth of the organic matter. Second is calliculus, that is more amount of mineral deposition onto the plaque, which is seen in yellowish discoloration. When the patient consumes all sorts of aggravative foods and all like this tobacco or cigarette or whatever, there is color uptake by this calliculus which is causing the discoloration onto his tooth. So this can be removed by general full mouth scaling.
Okay.
After that, to be more specific in brightening or decreasing the shade of the tooth, there is something called as tooth bleaching. So tooth bleaching is nothing but applying some amount of chemical agent onto the tooth proper, where it will break the colored substances on the tooth and lighten the shade of the tooth. In that, hydrogen peroxide is one of the elements which is used commonly in all the bleaching agents. Nowadays there are different toothpastes also which have been released into the market, something called as Colgate Brighty White or Mighty White. So many whitening toothpastes are there which contains different amount or different percentage concentrations of the chemical reagent like hydrogen peroxide, which will help in whitening the tooth.
Okay.
But if they want some instant betterment within a short span of time, in-office bleaching of the tooth is always suggestible because the concentration of the chemical would be high, and an expert who handles that can give you the better result.
Okay. What finally the take home message is, for immediate relief to get the teeth whitened, there are some procedures. But if they want to take these substances, still they want the teeth to be white. It is not a practical thing that can be done.
Yeah, how much ever it can be done. But going for aggressive procedures is not that suggestible immediately, because habit also should be considered into the point, because after doing a very good procedure also, if the habit is continuing in such a way, it doesn't give you any sort of great results.
Okay.
Because again the color uptake will be there onto the
Right.
tooth.
Thank you, Krishna.